Welcome to Tuesday Talks at Cure Studios. I'm Seema Kumar, and today we're joined by Dr. Elizabeth Comen, who has dedicated her medical career to saving the lives of women. She's an award-winning oncologist who is internationally sought-after clinician and physician scientist, specializing in breast cancer at NYU Langone Hospital. Her first book, All in Her Head, The Truth and Lies Early Medicine Taught Us About Women's Bodies and Why It Matters Today, became a USA Today instant bestseller. In her book, Dr. Comen discusses sexism in medicine, the history of women's health, and the increasing cancer rates among young people worldwide. Welcome, Elizabeth.
Thank you so much for having me and for that delightful introduction.
Yeah, and great to actually see you and get a chance to talk to you. And congratulations on your book.
Thank you.
One of the things I was reading the reviews about the book, and it's got a lot of good, glowing reviews and great endorsements, including from Dr. Siddhartha Mukherjee, who's a friend, but also a friend of Cure's. And in his review, he talks about really how All in Her Head is accomplishing a remarkable feat of storytelling. And coming from him, he's a master storyteller. That's high praise. And you're combining medical history and your knowledge of medical history and research you did on it with all the narrative, and the propulsion that a medical thriller has, right? So combining the two, you've written something that is engaging, but also is huge learning for people who read it and, opens your eyes to what we've all been through. So let's talk about the history of medicine and why that is so eye-opening. History of medicine, we learn so much by looking back at history. What inspired you to go that route?
So when I was in college, I majored in the history of science. I had this, I'm a Gemini, a split personality, and I love science, but we know that science is not this absolute truth that we're discovering in a vacuum, but is completely molded by the environment within which it's discovered, who has a seat at the table, who's asking the questions. And we know throughout history that women have not had a seat at the table, that Western medicine has not elevated women's bodies, the study of women's medicine as equivalent or as powerful, or even our intellect. We are more primal than men, so to speak. And history really engages in the experience of illness for women. And I think when we talk about biology versus experience of disease, it's two very different things. There's what you see under the microscope, which is, of course, influenced by what you're looking at. But then there's the individual and the stories they tell themselves about their bodies. And I really wanted to include those narratives throughout history to help inform why today I think women still feel unactualized in ways that I think we could empower their bodies and in their healthcare.
That's very interesting because, if you think about medical textbooks too, and then you see anatomy and physiology, and you learn, the famous drawing by Da Vinci even, you see it's a male body.
Right.
Right? Yeah.
Well, so that's why the cover of the book is a take on the ideal Da Vinci Vitruvian man, and it's a woman in a corset, and it's a little cheeky, sexy twist on that. So thank you for picking up that reference of, we're going to put a twist on the ideal man. But as you know, so much of medical history and discovery was based on the man as the typical and the female as the atypical version of that. You go all the way back into Greek history and whether it was Hippocrates or Galen, the idea that women were this inverted, imperfect version of a man, and carry that all the way through to, it wasn't until 1993 that women were required by the NIH to be included in medical studies. And the assumption was, okay, well, we can study cholesterol drugs on men and then assume that just if we dose them for women, it's the same thing. And whether it's medical imaging or diseases, this sort of idea that you could just translate it, of course, is not true, but what has happened historically.
I mean, that to me seems a little bit kind of, logically, right? Like, we're not speaking logic here, but logically, if you think about it, you would think that, oh my God, women are actually higher actualized human beings because they're able to give birth, right, to men. And you would think that that would actually be the inverse, right? You would have more respect and want to have more curiosity about the body of a woman that's able to do this miracle which we call birth, and yet not so. And you claim that, women have been voiceless throughout history and continue to be voiceless today. How so?
I want to pick up on a word that you said that I thought was very interesting. You used the word curiosity.
Yeah.
And I think being curious is what really helps advance the best of ourselves, whether it's science or conflict. When two people have an argument, right, there's that defensive response or there's
Yes.
that curious response. Why
Yeah.
is it that way? Why do you feel that way? Or whether it's science, why is the body behaving that way, as opposed to assumptions and defensiveness, which is how you see a lot of medical history being carried out.
Yeah.
So I got distracted by the word curious there. And I'm not sure that we are as voiceless today. I think we are gaining we're doing this,
We
right?
are, yes,
and you
we
are
are
certainly
gaining our voice. Yes.
empowered.
Yeah.
But I think it's complicated because you see, certainly in my practice, I treat patients from all walks of life, and some of the most powerful seeming voices that are women's voices may still have feelings about shame about their body, or in a doctor setting experience that power dynamic where it's hard to really advocate for themselves and have the type of voice that they may have in the boardroom or the courtroom, or behind a computer screen, whatever it may be. So it's about how we change that power dynamic, how we get and help women tap into their gut and align with doctors to really feel that they can ask the questions they want to ask.
That's so interesting because, okay, so we feel empowered in many different walks of life, right? We can go to a courtroom, as you said, and fight a case with all the passion and advocate for somebody else. Why is this feeling of shame that we have about our bodies? Where do you think that comes from?
I think there's such a long, long, long legacy of shame. I mean, even if you look at the history of some of the language that we use to describe women's bodies, whether it's the Latin root of pudendum, which actually means shame. You talked about textbooks, and we can touch upon women's sexuality, but the idea that in Grey's Anatomy at some points the clitoris wasn't even in there. So,
Yeah.
and throughout Renaissance, when they were started to do anatomical drawings, the idea that there were male
Female
anatomists
organs.
saying that they were discovering it and not discovering it and arguing over who could label it as if women didn't know where it was.
Yeah.
So there's a lot of fascinating history in there.
And, speaking of which, you spoke about some of this last week, actually, at CNN, right? And that was actually a special episode because CNN was reporting that cancer cases in younger women are on the rise by about 79% globally. However, in the older patients, it's dropped, older women, I should say. And you spoke about this with the host, Sarah Seidner.
Yes.
Right?